Yesterday, we discovered what we believe is the first case of coronavirus here in the state of Rhode Island.
That's Rhode Island Governor Gina Raimondo on Sunday, who announced the state's first presumed case of coronavirus. Rhode Island health officials had devised their own method of testing for the virus, the state's health director said, who added that the Centers for Disease Control must still confirm the finding. She also said that state officials are working to identify those who had direct contact with the patient.
This was an individual in their 40s who recently returned from a trip to Europe, which included time in Italy, France, and Spain. This individual is being treated in the hospital right now.
About 70 cases of coronavirus, also known as COVID-19, have been diagnosed in the U.S. The first fatality from the virus occurred Saturday in Washington state, and authorities there still don't know how that person became infected.
She was a wonderful woman, a medically high-risk patient in her late 50s.
The deceased is actually a man. Trump's mistake was addressed by his Health and Human Services Secretary Alex Azar on CBS's Face the Nation Sunday.
It is a man. How is a mistake like that made? Because people are very nervous right now, and getting some of these basic facts right affects public trust.
Well, I understand that. It's a very fast-moving situation. Our Centers for Disease Control and Prevention were up late at night, very early in the morning, working with the Washington State Public Health Office, and inaccurately recorded that the individual was a female. That's what the president was briefed on. They've apologized for incorrectly briefing on that, but it's a very fast-moving situation. Obviously, we regret the error.
Azar was then asked how many Americans he expects will come down with the virus.
We cannot make predictions as to how many cases we'll have, but we will have more, and we will have more community cases.
You have to have a number you're working with in order to make sure that you have adequate supply, things like testing kits, right? So how are we on shortages? You may not want to tell me the number, but you have one in your head.
No, we don't. In terms of testing kits, we've already tested over 3,600 people for the virus. We now have the capability out in the field to test 75,000 people, and within the next week or two, we'll have a radical expansion even beyond that.
Azar also said he was looking into a whistleblower complaint that his agency did not give adequate training to U.S. officials who greeted Americans flown to a California Air Force base from Wuhan, China, where the virus is believed to have originated. Rebutting Democratic criticism that the administration has bungled its response to the outbreak, Vice President Mike Pence, who was leading the Trump administration's response to the virus, told NBC's Meet the Press Sunday that the government has done, quote, everything possible to prevent the spread of the disease. He also tried to calm fears that the coronavirus could cause a global recession, saying the stock market, quote, will come back. The S&P 500 dropped 11.5% last week, the worst weekly drop since the 2008 global financial crisis.